Hey everybody, my name is Garth Mullins. I'm talking to you from Vancouver, Canada, in your recent past, because now, it is International Overdose Awareness Day. So I'm addressing you virtually. I wish I could be there to do this in person, because it's always better. I'm the host and executive producer of a podcast called Crackdown. I'm also a member of the Vancouver Area Network of Drug Users, and I'm a drug user activist. I've been a opioid user most of my adult life, heroin and methadone, but really there hasn't been an opioid that I haven't tried. So maybe a connoisseur as well. So thanks everybody for having me. I got about 10 minutes of comments, just particularly on the situation with overdoses here in Canada and the COVID-19 pandemic. And we gather today on a day like this. It's not a very nice day. It's not possible to wish someone a happy International Overdose Awareness Day. The problem is the politicians in our country and yours maybe are not as aware of the cost of this as they should be. So I'm just gonna look at the email here and see. You guys gave me some questions. So how does COVID-19 affect people who use drugs? This has been complicated, right? Because we've been saying for years, don't use alone. That's one way that people can protect themselves. You know, drug users, lots of us have Narcan. Here you go. This is what they look like in Canada. Narcan kit. Very, very nice design. Not like your guys' ones. Hang on, I bet you I even have it. No, you guys don't want to see me go looking for it. Anyway, it's a little case. You know what they look like over there. And inside is, you got your rigs. You got the actual Narcan, breathing mask, because we do put oxygen in. We do give people breaths, and gloves. So people have that and are encouraged to get trained and use it and keep it around. And so if drug users are using together and one of them overdoses, the other can bring them back. And we've done that an awful lot of times around here. But during COVID, we've had to say, no, maintain space. Don't be right next to other people. So it's quite a contradictory message for people to hear. And I think a lot of drug users have been felt stuck between those two spaces. The other thing that's happened is a lot of our harm reduction facilities, including safe injection sites, what you call drug consumption rooms, have diminished capacity. So for social distancing, so people can keep 2 meters apart, there's less capacity in them, so less people can get in. There's also been less hours sometimes and less staff sometimes. So less people are able to use their drugs in a way that is observed. I guess another one of the complications from COVID-19 is that the borders have been closed, and the illegal drug market here in North America, as most of the world, is very global. So there's supply chains that go all over the planet, just like most commodities now, and closing borders restricts the supply chain. So the price of stimulants, cocaine, and crystal meth has gone up. Some of these have gotten rarer, and what's sold as heroin, which is mostly fentanyl right now, has gotten even stronger. So we've noticed the coroner has found concentrations of even stronger forms of contaminated drugs in people's system. So the next question. The next question is, have I seen a rise during the pandemic overdose crisis in fatal overdoses or other drug-related deaths due to the public health crisis? Absolutely. Here in British Columbia, Canada, we have a population that's not that different from Scotland. And the last 3 months probably have been record months. So the highest ever number of monthly overdose fatalities that we've ever seen. So yes, more people are dying. It's a more dangerous time. There's more call-outs for non-fatal overdoses. So we're all still reversing overdoses as drug users and comrades of people who are in trouble, but also, the ambulance people are still running around too. You still hear sirens wailing. Like, if I get through this 10 minutes talking to you without a siren blazing past the window over there, I'll be surprised. But now that I've said that, maybe just Sod's Law, it will happen. I mean, that will be good. That'll be good. The next question is, have any positive changes been implemented? Yes, they have, and I'll tell you how that happened. So usually for methadone, you have to go every day to drink it at the chemist or the pharmacy. The first thing was the federal government changed the rules so you don't have to. More people can get carries. More people can take their methadone home, and you can visit your methadone doctor over the phone or over the computer. So it's just not putting people directly in these physical locations. Seems to be doing all right. That's one of the things we've been fighting for forever. We were in meetings with the federal government, and eventually this broke. So drug user activists definitely had a hand in this. As we saw the pandemic getting closer, we were telling the government the moves that they ought to make for this. In BC, I was a co-writer of a policy called Risk Mitigation in the Context of a Dual Public Health Emergency. And of course, that's a mouthful, but it was a very quickly written policy by which doctors are now able to prescribe hydromorphone, Dilaudid, benzos, Dexedrine, not exactly the perfect pharmaceutical version of what people are doing. So not the pharmaceutical version of heroin, crack, or speed, crystal meth, but cousins, things, family members of that same molecule that are more closely related than methadone. And I know a lot of people, in BC, a lot of doctors are like, what the hell? We're supposed to be using methadone to treat people and to kind of nudge them away from the drugs that they were doing before. But, in BC, in Canada, the drugs are just getting stronger and stronger and stronger and stronger. Fentanyl, carfentanil replacing heroin. And meanwhile, the methadone is getting weaker. So a new sort of branded formulation was introduced a few years ago that doesn't work for a lot of people. So the drugs are stronger, the methadone's weaker. You got this big gap to fill, and a lot of people are falling through that gap all the way into their graves. So a lot of us in the drug user activist movement have said, look, it's very nice. People can get treatment, recovery, and everything, but that doesn't work if they're dead. So job number one, keep people alive. And to me, that means if people are wanting to use heroin, give them diacetylmorphine, give them pharmaceutical grade heroin. This has happened in Europe. We've tested it here. It's not rocket science. And we all in North America learned this painful lesson during alcohol prohibition. There's no need to learn it again. But I guess we learn from history that we don't learn from history. So that policy was a breakthrough. It was good. It was a good step forward. It was sort of casted as temporary. We were going to fight for it to be permanent. But I guess we'll see. I guess we'll see what happens. And like I said, the doctors who are really uncertain about this are resisting, are just saying, no, I'm not going to prescribe this. So we're still having a big problem with doctors that are like, this person is sick, this person has a problem, I'm going to go fix them, instead of like we as drug users saying, look, I just need to stop having to grind every day to get my fix. I need to stop having to do something that's from the dangerous illegal market that could kill me. Just let me level that. That is a huge, massive step in someone's recovery. If they're not scoring off the street, if we're not having to come up with the money to do it, if we don't have all those interactions with law enforcement and the hospitals, the courts, all that, it stabilizes your life a lot. You can do a lot more with it. And the fourth question is, what changes do people who use drugs want to see? So this is the same demand that I've really thought about for probably 20 years, is prescription heroin. Like, the thing that people want to use has an equivalent that's at the chemist, that's at the pharmacy. It's just the rules that don't let us have this. And for us, for the overdose crisis, that's how we get out of it. You just have to let people have the thing that they're doing anyway. And that's what we've been demanding for a very, very long time. That's what'll get us out. So, I don't know how that translates to the experience in where you all are right now. I can tell you, though, the only way that things ever change is when we fight for them. So the number one ingredient, if people want a safe injection site, better naloxone distribution, better harm reduction supplies, or if they want to go the full thing for decriminalization, legalization, and a safe supply, which is what I want, you're going to need a drug user movement. You're going to need drug user activists like me, like all the people I work with, like the people that I met when I was in Glasgow, all working together with allies and fighting the government, understanding even when the government says very nice things, as long as they keep those laws in place that make us criminals, they're the enemy. And so on International Overdose Awareness Day, I say the people who look like big friendly figures in the world, like Justin Trudeau, well, he's an enemy to drug users. He is continuing a system that is causing our deaths in the thousands. And so International Overdose Awareness Day, who I want to be really aware is I want the lawmakers to be aware. I want those people to know that they have blood on their hands unless and until they change the laws. And we're here to help them draft the new ones. So, yeah. The phone lines are open. They can call anytime. Anyway, thanks very much, and I hope we all see each other in person soon.